To talk about health, and in a fun way, we are pleased to be joined by Dr. Kathryn Pearson of Precision Imaging Center to talk about an important topic, yet in a fun way, breast cancer screening. Good morning, doctor. Thank you very much for joining us. It's not every day we have mimosas and sangria on the show, although we would like to. Describe why we have drinks poured this morning.
Okay, so Precision Imaging Centers is a state-of-the-art diagnostic, radiology, and imaging center that is continuing to pursue its mission to promote women's health and breast health in particular. And we know that breast cancer screening really needs to be going on year-round, not just in the month of October. So we are launching Women's Weekends every weekend to provide weekend availability for screening mammograms, and women may come in and get sangrias and mimosas before their screening mammogram.
And I would venture to say, since you're providing this to the women, that these drinks have no effect on receiving the mammogram, totally healthy, won't throw off any possible diagnosis or anything like that?
To be honest with you, it helps because women, when they're relaxed, they're able to undergo the positioning better, their chest muscles are more relaxed, and the technologists are able to get better mammography pictures. So at Precision Imaging Center, we're dedicated to improving the women's health with seeing this early breast cancer detection with mammography. And so we're trying to encourage women to come in for that essential mammogram and provide the most pleasant, convenient, anxiety-free experience that we can. And this is one way we can do it.
It's kind of like a community feel, in a way. It's kind of nice.
So why is it important to make sure you get your screening?
So every year in the United States, there are almost 300,000 breast cancers that are detected. But it's more important to remember that there are more than 4 million breast cancer survivors out there. And so most of these breast cancers are, many of them are detected as an abnormality in the breast, such as a lump, but many are just detected in women that have no symptoms and no family history of breast cancer. And if we detect breast cancers on yearly screening mammograms, most of those are curable without any need for significant surgery and no need for toxic chemotherapy. So we're very passionate about getting women screened early and often, and we're trying to entice them to come do it.
Well, and with mimosas and sangria, who wouldn't want to join in Women's Weekend every weekend? Dr. Pearson, you and I were just talking off camera before this segment began. Yes, this is your career, but this is also deeply personal for you as well.
It is. I have certainly been put here by God to take care of women. My whole family has had breast cancer going back 3 generations. I had the early signs of breast cancer in my mid-40s, went through the downgrade and the upgrade, and so I absolutely understand what women are going through. And so when I was 27 years old, I was told I had a lifetime risk of 85% of developing breast cancer. So I decided to learn everything I possibly could about it, and I went through all my training at Stanford and UCSF, doing a breast imaging fellowship, and I was recruited to come to Jacksonville in 1998, and I've been here taking care of women. I've seen lots of women throughout these years, but I want to make this as pleasant for them as possible. Most of the time I tell them good news, and when it's bad news, it's not really, really bad news. It's a small bump in the road that we can get them through.
Well, because now it's, yes, there's an issue, but we can treat it.
We can treat it.
We can treat it.
But Women's Weekends every weekend is a way that women can gather up their girlfriends, their sisters, their daughters, their mothers, and make a weekend appointment for a state-of-the-art 3D mammogram and come enjoy a sangria or mimosa, light refreshment. And so we're doing this at Precision Imaging Centers starting now with weekend appointments available from 8 a.m. to 8 p.m. on Saturdays and Sundays. And I think women will enjoy that experience a little bit more.
And should they just call Precision Imaging Centers if they'd like to make an appointment? I would recommend, appointments are probably recommended,
yes,
right?
They are. They can go to the website for Precision Imaging Centers or the 904-996-8100. But it's so important women get their yearly mammogram. And the NCCN guidelines, let me just throw this in here, National Cancer Comprehensive Network has said that we need to have a risk assessment by the age of 25 and early screening mammograms at 40 unless they're high risk and they need to come earlier. So it is really important that women do this.
Absolutely. Early detection is the key. Well, Dr. Pearson, here's a mimosa for you.
I would love a mimosa.
Absolutely. All of that information will be available within this story on our website, firstcoastnews.com. But let's cheers to early detection.
Thank you, Rich.
Thank you,
Thank you, Robert.
Thanks for bringing it in.
Thanks. I love taking care of women.
Right after this.